Good evening and welcome to Randi Gaines Presents. And the topic is inhalants. So, a person who is abusing inhalants are basically inhaling through the nasal passages substances that are not usually naturally occurring in the body. Some are nitrites, like nitroglycerin, amyl nitrite, butyl nitrites, halothane, nitrous oxide. Some people are abusing solvents like butane, glue, gasoline, paint thinners, and then you have the aerosols that they're abusing. That's the hairsprays, typewriter correction fluid. The newer inhalants are called poppers. They are located at the top right of your screen. They are used a lot on the party scenes. Um, what the what the user will do is you screw the top off, and as is being illustrated in your bottom right hand corner, they simply inhale the fumes. And these are perfectly legal poppers. You can get them at gas stations. You can get them at some of the specialty stores, and they are legal to possess, as are most of the inhalants are household products. So, our etiology and neurobiology, what's happening when people are abusing inhalants? Their inhalants are readily absorbed through the lungs because they're inhaling it directly. So it's going through the nasal passage, entering the lungs. Um, your lungs, of course, are not supposed to have caustic substances in them. And a lot of the times, those substances are directly having direct effects on the person's brains and tissues and organs. So they don't have an exact mechanism of how it is hurting everything. But the studies show that inhalants, with the exception of nitrites, are depressants, and they act directly on the central nervous system. They are also readily absorbed through the lungs and rapidly metabolized through this CYP five 450 system of the liver. So some of the acute effects of in- inhalation are intoxication, disorientation, impaired judgment, hallucinations, and nosebleeds. Um, Inhalants only last a couple of minutes, so a lot of people use these in party situations, and because they don't really register it as a danger, they use them back to back to back. So as soon as the high starts coming down, they just inhale another popper or whatever they're doing. Um, One of the more famous people known for inhalants was a guy named Steve O. He was from the Jackass franchise, and I don't mean jackasses like it was an actual show. I think everybody's old enough to remember Jackass. But he was a chronic abuser of inhalants and poppers, and once it starts burning your brain cells, you don't get those back. So the chronic effects are PNS and CNS system dysfunction. They have liver problems, kidney failure. Um, Sometimes you can actually have memory losses. And so a lot of people actually have shown brain abnormalities on MRIs. as compared to those of cocaine abusers. So, some of the effects of the inhalants are dizziness, irritability, tiredness, loss of appetite, headache, photophobia, or cough. A lot of times when these people present to the emergency room or in the office, sometimes they actually will have stains on them. They might have chemical burns. Um, they might have spots or sores on their mouths. Might be um, having runny noses. Um, so sometimes they inhale the vapors directly from a container, which is called sniffing. Sometimes they do it through a bag. Surely I've seen it on movies where they have the brown paper bag and they spray something in and they huff real hard on the bag or the balloons. And sometimes they soak the substance in something and then inhale the fumes from the rag. Um, Inhalants can actually cause medical emergencies. Um, so a lot of times in an acute presentation, it can cause unconsciousness or death, um, literally because they shut their brain down, and you need your brain to be on to tell the body to breathe. So, if depending on what it is that they inhale, it causes a anoxation of the brain, and so now they die because their brain didn't work anymore. Um, the chronic abusers can damage their um, heart, their heart, lungs, kidneys. Um, it can cause bone marrow suppression. It causes fetal abnormalities if somebody's pregnant, and it can cause the death from ventricular arrhythmias. So, the prevalence of people who use inhalants are usually younger people. The studies say most commonly between 12 and 17, though it can um, extend to the 25-year-olds, like the college age students. Um, Inhalants are exceeded only by alcohol, tobacco, and marijuana, and they're actually on back on the rise. The numbers had gone down, but it's starting to get popular again. And there's a lot of rappers and influencers on TikTok that are using poppers. So if you actually um, you would have to know what it's called and look like to know what you're looking at, but they get high on the TikTok, and then you just see them cracking up, laughing, and doing really reckless stuff. So 70% of the deaths were 22 or younger. 95% were male, and 46% of the fatalities were from gasoline fuels. So they huff a lot of gas and kerosene, like some of the readily available um, things that they can just get their hands on that are very legal, but you can't make gas illegal. So our labs and diagnostics, um, the best way to diagnose some of these things are actually just to do a good assessment and ask the person if they are using inhalants and what inhalants they're using, because some of the testing is not specific. We use general tests to see if they have deficiencies and abnormalities, like from dehydration or whatever, and if they're having electrolyte imbalances um, because of the um, shutdowns of the different systems depending on where they are in their use. So the best thing we really can do is actually ask them, what did you take? So you can use a complete blood count. That's more to see if they have an electrolyte imbalance or a acid base imbalance. We're going to look at their liver and kidney functioning. We'll look at their cardiac enzymes to make sure they don't have any cardiac involvement. And then the urine studies. But again, we do a lot of these diagnostics just to see about the impairment they've done, and it's probably as a result of chronic use of the inhalants. So many of the patients who use inhalants are not treated with medication because we really want them to either never start or sometimes they actually age out of it because they find other stuff to do. And a lot of times when people are using inhalants, this is kind of a peer pressure type drug use. They would benefit from CBT therapy, but a lot of them are resistant to treatment. And as I said, a lot of the users, they use in a social setting, parties, raves, and again, some people actually just stop all by themselves. Some people actually do receive treatment, and a good bit of people actually suffer from anxiety and depression, and the inhalants strip their inhibitions, and so they're able to, as they would say, relax and party more. So that's why they use it. So the treatment would be to treat with supplemental oxygen, because again, this is going to cause damage to their lungs, and so we need to actually get air to their lungs, because some of this stuff can be caustic to the alveoli, and it sticks and makes stuff not open, or sometimes it burns the alveoli. It just causes severe damage to the lungs and nasal passages. Chronic users tend to resist treatment, and the best treatment is prevention. So basically telling them to never start to begin with, which for teenagers sometimes can backfire because you tell them not to do something and they'll do it just to be spiteful because they're teenagers, what they do. So this is the end. These are my references. And you all have a good evening. Thank you for being part of my presentation.